Causing cervical cancer infects millions of women each year. There are two types of tests to screen for cervical cancer. New research suggesting one early test over the other one. KTK's Teresa Sardina right now live in Tyler in the medical district with more on this.
Hello, Neil. HPV is human papilloma virus. It's a sexually transmitted infection, and it's more common than you think. Local experts tell us the best way to detect this virus.
The HPV is the most common sexually transmitted infection that we know of.
OBGYN Dr. Adam Newman says if HPV is untreated, it can cause health problems like genital warts and cancer. A pap smear test and an HPV test are two ways to detect cervical cancer. Experts at Cancer Care in Canada say HPV testing should replace the pap smear test as the first screening procedure.
The results of the HPV testing is important information to know looking towards the future. But whether or not you have a high-risk HPV type present or not doesn't necessarily tell you what your pap smear is going to read.
There's multiple strains, multiple varieties of HPV. It's not just HPV-1, it's HPV 16, 18, 21.
Dr. Newman says he recommends a pap smear test first.
What your pap smear reads is telling you whether or not there are any atypical cells or any abnormal cells in your cervix that may require treatment.
He tells us that's when HPV testing is recommended.
So it is incredibly prevalent. At least 80% of women and men will be positive for it, at least at some point in their life. Now, the vast majority will clear it.
Dr. Hope Short says you can follow abnormal pap smears and HPV can go away if your body is healthy enough to fight it.
It's sexually transmitted. The boys carry it to the girls, but they don't usually come in with warts. They don't usually present with any symptoms.
And coming up at 6, we'll tell you some other factors that increase your risk of getting HPV. Reporting live in Tyler at the Medical District, Teresa Sardina, KETK News.
The employment rate